Right, everybody. Hello and welcome to our final session of the day. Um, Thanks for joining. I'm Ben Lashak. I'll be moderating this session. And we also have Rita, who is managing the Zoom for us and making sure that all of our tech is running smoothly. Everybody should be muted as you join the Zoom room here, but feel free to come off mute for the Q&A session. You can also use the chat for any comments or questions, and feel free to rename yourself and put your pronouns in your Zoom name by using the rename function. I'm excited to introduce our presentation here today. We've got about 25 minutes for presentation and about 10 minutes for Q&A after that. But our session today is Evaluating Denver's Citywide Food Insecurity Initiative for Kids and Families, Leveraging Data Systems, Visual Analytics, and Community Collaboration for Health Outcomes. I'm personally excited about this presentation for a few reasons. One is that the Healthy Food for Denver Kids program staff are my old colleagues at DDPHE. I'm not there anymore, but I'm really excited to see what they're up to. But the other thing I'm excited to hear about is, in my day job, I'm an evaluator, and I kind of sit in this similar role of I got data that lives in all these different places, all these grantees. And we're always asking ourselves, like, what's the most efficient and equitable way to gather that data? How do we use it to make good decisions in real time? And then how are we sharing that information back, not just to the program staff, but to the people who are providing that data as well? And I think we're about to see a really good example of that. So without any further delay, I'm going to hand it over to our panelists, Emily, Youngmi, and Michaela. So go ahead and share screen. It's coming online. Awesome. Take it away. Thank you.
Perfect. Thank you so much for that introduction. It is great to be with you all today. My name is Michaela Bobrow, and I am the project director for CAI's Healthy Food for Denver Kids Evaluation Initiative. So we are thrilled to be here today to talk with you all about evaluating Denver's Citywide Food Insecurity Initiative for Kids and Families, leveraging data systems, visual analytics, and community collaboration for health outcomes. So, as you already heard, I am joined today by my colleagues, Emily Leung, who is our evaluation lead, and Youngmi Cho, who is our evaluation associate. All right, so our objectives for today's session are that by the end of the session, you'll be able to describe how a project management platform and database facilitates collecting, analyzing, and reporting data to improve program impact. Understand how to utilize real-time data visualizations and geospatial mapping to identify resource gaps and guide strategic planning for addressing citywide food insecurity, and that you'll be able to learn how integrating program level and citywide evaluations provides a comprehensive understanding of program impact and persistent food insecurity trends. So we will accomplish all of these objectives by the following agenda items. So after our welcome and introductions, we will provide an overview of HFDK and CAI's evaluation approach. We will discuss QuickBase, which is our project management platform and database. And then we'll discuss real-time data visualizations and geospatial mapping. And then we will close out with some time for you all to ask us questions and hear your thoughts. So before we dive into all of that, I want to start by just telling you all a little bit about CAI. So CAI was founded in 1979 and is a diverse, mission-driven nonprofit organization with offices across the US, including in Denver, and our headquarters is based in New York City. CAI's mission is to use the transformative power of education and research to foster a more aware, healthy, compassionate, and equitable world. We help healthcare and social service agencies improve the quality of their services, addressing health inequities. And we do this by providing training, technical assistance, curriculum development, research and evaluation, and other capacity building support to agencies. And we ensure that our work is evidence-based and research-informed and really prioritizes the experience of the communities we serve and leads to meaningful impact. And we use a range of evaluation methods that are action-oriented, culturally responsive, and equitable, using real-time data and data visualization and collaborative learning. And we're excited to share a little bit more with you about how we bring this all to life. So now that I have shared just a little bit about us, before we really dive into the presentation, we'd love to get a sense of who is in the room with us today. So if you wouldn't mind sharing just what is your professional background so we can get a sense of who you are, if you work in food systems, if you're research and evaluators, if you work at a nonprofit, government, education, healthcare. All right, I am seeing some polls coming in. All right, I think everyone has answered, or almost everyone has answered. Great. Okay, so it looks like 50% of you work in government, so that's about or that is half. And then research and evaluation at 20%, 3% food systems, 7% nonprofit, 3% education, and 7% healthcare. Okay, so we've got a range of folks in the room with us, so that's great to see. And I'd also love to hear what drew you into today's session. So please feel free to drop in the chat if there's any specific reasons you're here, anything specific that really interests you most. And we'll be excited to take a look at that as you're dropping that in the chat. But I will continue on and start by sharing a little bit of an overview of the Healthy Food for Denver Kids initiative. So we can go to the next slide. Go one more. Sorry, Emmy. Thanks. All right. So the 2018 Denver ballot measure 302, the Healthy Food for Denver Kids Initiative, or HFDK, established a fund for healthy food and food-based education for Denver youth by increasing sales and use tax by 0.08% in the city and county of Denver. The ballot measure was approved in November 2018 and went into effect in January 2019. And the Denver Department of Public Health and Environment, or DDPHE, distributes these funds through competitive grants to nonprofits, local government agencies, and public schools throughout the city of Denver. This fund is expected to generate $11 million annually and will be collected from January 1st, 2019 through December 31st, 2028, and distributed by December 31st, 2029. So this slide here shows the 42 grantees that are currently funded by HFDK. And these organizations are really diverse in size and scope. So from Denver Public Schools, which is one of the largest school districts in the country, to smaller community-based organizations that are really deeply rooted in neighborhoods and focused on increasing access to food and food education for their communities. And I want to just share a few accomplishments from these grantees from the most recent year of HFDK, just to showcase a little bit of what they've done. So grantees have served nearly 196,000 youth and 149,000 families. And while we recognize that there may be some duplication across organizations serving the same youth, so that number might be a tiny bit inflated, these numbers do suggest that HFDK is reaching the vast majority of youth in Denver. Grantees have also distributed nearly 8 million pounds of food to youth and families in the last year, another huge accomplishment. They helped to enroll over 8,828 households in SNAP and 2,428 families in WIC. They provided 12,350 total instructional hours of food and nutrition education programming in this last year. And they also harvested almost 190,000 pounds of food from their gardens, farms, and grow sites throughout the city. So these organizations really have had such a far-reaching impact on Denver's youth. So I just wanted to spend a moment here to highlight them. So the HFDK vision is that all Denver kids have reliable access to healthy, nutritious food and food education that helps them grow, learn, and thrive for life. So it's really a priority for HFDK that all youth, regardless of their background or where they live in the city, have access to healthy, nutritious food and food-based education. And equity is really at the heart of this work, and HFDK is committed to ensuring that every young person in Denver has the resources that they need to grow, learn, and thrive. So this slide here shows the current HFDK theory of change. So this is what really helps HFDK concretize how the work they do in the areas of healthy food access, food education, and food procurement and distribution really leads to that project vision that I just shared. So it really starts with the key HFDK strategies on the left-hand side that grantees are working towards, including the distribution of healthy meals, snacks, and groceries, federal nutrition assistance programs like SNAP and WIC, and child nutrition programs like summer meals and CACFP. And through the corresponding outcomes and impacts stemming from the strategies really leads to that vision that I shared. So as the evaluator, our hope is to be able to describe the grantee successes as they relate to the outcomes on the slide. So as a collective whole, how has the work of HFDK grantees contributed to kids and families being connected to and using healthy, affordable, and culturally relevant food in their neighborhoods, kids experiencing food system education, kids and their families participating in food assistance programs, eligible sites participating in federal programs like CACFP and SFSP, and other key outcomes. And all of this leading to greater impact on Denver kids' food security and education, and really the broader Denver food system as a whole. So to understand that impact, we have developed a two-pronged evaluation approach. So we first have our HFDK program evaluation, where we use grantee level data to measure outcomes and impact and identification of best practices. And we capture information on the range of activities each grantee is administering on a quarterly basis. Additionally, we conduct a citywide landscape analysis where we examine how population level changes in food access, food education, and food assistance have changed across Denver for children and families, and how HFDK grantees have really contributed to those outcomes. And as the evaluator, we knew we needed to identify a way to categorize and measure the range of activities being administered by all of these diverse different organizations that are getting funding from HFDK. So we started by first reviewing the scopes of work for each of the grantees. We then reviewed relevant literature and worked with food system experts to help us identify how best to categorize and measure the work that grantees are doing. And after this initial process, we determined that the key buckets of work among all the grantees fell into the 4 categories that are listed on the slide. So that's food access and distribution, food and nutrition assistance, food and nutrition education, and food production. And then we then developed our grantee reporting form, which includes an overall section for all grantees to complete, as well as individualized sections by these 4 buckets that a grantee only completes if their work falls within that category. So with that, I am going to pass it over to Young-Mi to share with you all about the project management platform and database that we use.
Thank you so much, Michaela. And sorry, we're actually going to have Emily share her screen now with the slides, since I'm having a couple of difficulties. So thank you for your patience, everyone, while we navigate that.
Currently seeing note view, just so you know.
Awesome. Thank you so much, Emily. Really appreciate it. Just like Michaela said, I'll be diving into QuickBase next and telling you all about how QuickBase helps us collect and analyze grantee submitted data. So as part of CAI's evaluation, grantees submit reporting forms reporting on their HFDK related outputs and outcomes. They submit these on a quarterly cadence or every 3 months. And there are 5 sections on the report, just like Michaela mentioned in the last section, corresponding with the HFDK buckets of work. And you'll notice here there's that overarching section, which is the section that all grantees report on, regardless of their bucket of work. And again, they're submitting these reports to us on QuickBase. So what exactly is QuickBase? QuickBase is a dynamic cloud-based, meaning it's hosted on the internet, project management platform. And what exactly can QuickBase do? Well, it collects grantee data, which allows us to compile and analyze the data to create reports, highlights key trends and insights that we want to share with key stakeholders, HFDK commission members, and our funder, DDPHE. And these trends and insights shared with the folks I just mentioned can help support strategic decision-making and also provide transparency on the program performance. So what does QuickBase offer for grantees? Grantees can log in whenever and access their data in real time, meaning there's no lag or wait for their data to update. Real-time data updates automatically feed into data dashboards that are also updated. And the visualization of data can help grantees actually see outputs and outcomes and use this to inform and enhance their programming, services, and reach. So off to the right-hand side here, we see an example of one graph that can be seen from the grantee data dashboard. This image here is the unduplicated youth reach and can be displayed over a quarterly period. So grantees are able to come back and review any trends in their data and analyze any data for areas of improvement. On this slide here, you'll see that our specialists at CAI developed the HFDK reporting platform so that we're able to share all the grantee data directly with our funder through this platform. So again, on this one, you can see here individual grantee data as well as aggregate data across all grantees. So this one in particular is a dashboard of the aggregate number of youth served across each quarter across all grantees. At CAI, we strongly believe in data visualization and how that can be utilized in telling a compelling story, which can lead to actionable insights. So through QuickBase and the products and deliverables that I'll discuss further in a moment, we've been increasing access to grantee submitted data. Making access to this data is more equitable so that people across organizations can be looking at this data, regardless of their role. And data through this way has become a two-way street. So it's not just us, the evaluator, or DDPHE, the funder, seeing this data. And with the use of grantee submitted data, we can create a deliverable like an impact summary, which you can see here on the left-hand side. These highlight key outputs and outcomes and share the breadth of the impact and reach HFDK has done and can be shared with a variety of audiences like the general public, the Denver mayor, and we can also use these data to create other deliverables like reports. They also help us identify TA and webinar topics that might be interesting to grantees and support them in areas that they identified are a challenge. And finally, data will also be visualized in the form of maps. So grantee data can also be used to visualize geospatial data and show things such as where services are being delivered and what neighborhoods throughout Denver. So with that, I'll pass it off to my colleague Emily to go further into real-time data visualizations and geospatial mapping.
Thanks, Young Mei. So the last part of our presentation, we're really focused on sort of pulling everything together in an innovative way. So analyzing program data, so what Young Mei talked about, all the data from QuickBase, grantees programmatic data, and looking at publicly available data, citywide data, to get a more comprehensive understanding of program impact in the context of what's happening in Denver, and doing all of that through geospatial mapping. So we use a geographic information system software called ArcGIS to visualize health and programmatic data and geographic trends. These maps have been really allow us to identify priorities and gaps such as patterns of equity and inequity in food system access across Denver. Last year, we developed a collection of maps visualizing data from each work bucket and overall reach for HFDK. This is an example of a map from that collection. This map shows the number of HFDK grantee service delivery sites overlaid on top of priority neighborhoods. And what we mean by priority neighborhoods are ones that are in the darker teal color, which indicates high food insecurity rates. And how we define priority index, we use the food insecurity measure in the American Community Survey data from 2017 to 2021. So on this map, you can see that the grantee service delivery site clusters are the yellow bubbles. And we see that there are larger clusters of HFDK service delivery sites in higher priority neighborhoods in the West, for example. However, there are still some high priority neighborhoods with fewer grantee presence, fewer service delivery sites. And we highlighted some in the red boxes. And this is an example of the way that we have used data to engage grantees to look at whether the program is reaching priority neighborhoods in equitable ways, and how might grantees think about expansion of their services or redirectment of their services to better serve other high priority areas that don't have as much grantee presence. So we have used these maps in our cluster technical assistance sessions, and also during a all grantee convening more recently to engage grantees in conversations and collaborative analysis of data and of these maps. And we also, we put some quotes here of some immediate reactions from grantees. So one of our grantees said, it's very helpful to see this data put into pictures and shown in maps. And another grantee said, it's fascinating and meaningful to see what we're doing. We are also hoping to unveil a publicly available resource soon, and we're very excited about this, which will have the full collection of maps we developed. And we're hoping that users will be able to read about the project, learn about it, about each of the topic areas, and also explore the maps in their own time. We made this resource colorful, engaging, and user-friendly so that interested users can learn and engage with the data in a way that tells a story. And we're working on making this resource available in Spanish as well. And we're really hoping to disseminate via a publicity campaign so that everyone, including council members, policy members, partners, and community members, can engage and interact with this data. We are also planning on mapping some partnerships in the future and help grantees think through strategically, how they can enhance our partnerships, so to decrease duplication of efforts, and also just see what other partners and grantees are doing. And we're also exploring layering different additional layers of the maps and metrics to visualize and get a better understanding of, for example, like what schools are around and what other resources are around for grantees and for community members in terms of food insecurity and food access. So with that, that's pretty much the end of our presentation. That's an overall snapshot of the current work HFDK is doing. We want to thank you all so much for attending this presentation, and we want to open it up for questions from all of you.
Awesome. Thanks so much, everyone. Yeah, feel free to come off mute, raise your hand, put it in the chat. We're ready. there we go. Rita.
Thanks so much for that presentation. So my question is, I'm very curious about the impact summaries that you showed. I wanted to know, have you had any feedback from grantees? Are there specific measures that they wanted included, or things in particular that they really liked in terms of measures for those?
That is a great question. I would say for impact summaries and really like our data dashboards that we have on QuickBase, a lot of that has been directed by kind of what the funder has been wanting to see, but I would say that grantees really get access to they can really look back and see all of their data in their data dashboards. So we actually just had a convening where we brought all of the grantees together and we did an activity where they could log into QuickBase, look at those data dashboards and really do some reflection on it. So, and that's also a time where we get feedback from grantees about if there's something new they want to be seeing, and we always take that into consideration. So I would say less for like those pieces, we haven't gotten as much feedback, but like for the mapping pieces, for example, we have gotten feedback from grantees saying like, hey, we'd really like to see this information overlaid on the map, and that would be really helpful. And then we absolutely take that into consideration and apply that. So we regularly are checking in with grantees through our technical assistance meetings, just kind of regular communication, as well as these more intentional spaces as well. Thanks for that question.
I think kind of to add on to that, one question that I had was, we often think about evaluation and data reporting is kind of burdensome for grantees, because it is, like data collection and analysis is costly. It takes a lot of time, and you have a mission to serve, and so we don't want you, spending time on things that aren't helpful or useful. Kind of like Rita mentioned, there were a couple of quotes of like, hey, this thing was really helpful. I guess, for the rest of us who are maybe in these evaluation or research roles, or just funders in general, how can we do a better job of making our reporting and evaluation helpful for grantees? And like, what strategies or, approaches have you used or found effective in like identifying those pieces where like that aha moment of like, yeah, I do want to know that. That's not just a funder question. That's like something that I want to know as well.
I can start, and then Emily and Youngmi, if you want to chime in. I think that this is always a challenge with evaluation, and managing that balance of needing to collect data to showcase impact, and also understanding that it's a huge capacity challenge and can be a burden for grantees, right? It's really hard to find that balance sometimes. I would say one thing that we have done is really trying to dial in on why are we asking each question that we're asking, and really making sure, is this information that needs to be shared back with the community, that will be shared back with voters eventually to say, hey, here is the impact of this program. And is this really helping to showcase the impact? So I would say we really kind of dialed in on every single question with that lens to try and figure out like what questions really might not be so necessary. So that's one piece of it. I would say that, it has been an iterative process, and we have, changed questions as well over time as we have gotten feedback from grantees and from stakeholders as well. So that's something we really worked closely with DDPHE and the HFDK Commission as well to make sure that we were asking the most relevant questions. I can pause there. Emily or Youngmi, do you have anything you want to add in about that?
Yeah, I have maybe 2 points to add. I think to just add on to what Michaela said, we're also, as a team, we really think strategically about and intentionally about feeding the data back to the grantees to spark thinking. Because I do it too, I submit a report and I don't really think about it. But we don't want that to happen because, as you said, it's a lot of effort and people hours trying, submitting and collating all this data and collecting it. So when we look at it as a team, we try to create summary reports, dashboards with like facilitated discussions with the grantees to say like, this is a summary of all the like sort of, for example, like age breakdown of who you're reaching. Does that make sense? Is that part of your goals for your program? And if it is, that's great. You know, you're hitting your goals and your metrics. If not, like, what can you do differently to better outreach to the age groups that you want or you intend to, you know? So it's sort of pairing the data with facilitated discussions and coaching. And I was going to say something else, but I think I forgot. So I forgot what it was. But if I remember, I'll chime in again. But Youngmi, do you have anything else you want to add?
Well, I thank you and Michaela. Just, really covered everything, and I don't want to be, offensively redundant. So
I see that a question was put in the chat about if we could give some examples of how summary reports, dashboards, products have been used to implement new programs, make decisions. So at this point, I think one thing we didn't share was we just came on as a newer evaluator just over a year ago. So there was a previous evaluator beforehand. So we came into the project partway through. So even though the initiative has been going on for a while, we've only been the evaluator for just over a year. So the way that we have been using this is, we have been, as Emily was saying, showcasing the dashboards, having these facilitated conversations, and helping grantees think about if, there are things that they want to change about their program. I don't have examples of, yes, I know exactly they changed X because they did this, but that certainly is the intention. And I think we'll start to see that over more time. We just haven't been in this role for that long at this point.
Looks like we've got another question in the chat, but just kind of how does the funding cycle work? Of like, is this annual? I think I'm not sure if that was covered in the presentation, but just kind of what is the application funding cycle? What does that look like?
Yes, I am not an expert on this part of it. And Youngmi, you might be better equipped to answer this a little bit. But yes, they apply through DDPHE. DDPHE announces funding cycles and grantees then apply. And so grantees do not interact with us until they are chosen to be grantees, and then they are introduced to QuickBase and this whole data system. Youngmi, did you want to add anything, or did I cover it all?
I think you covered it all. I guess maybe if there's something for me to add, from my understanding, it seems like throughout the different cohorts, it was either like a one-year contract or a multi-year contract as they're kind of, testing out what's that perfect sweet spot. So I think it kind of depends what cohort you ended up being in, and I don't want to like speak on behalf of our funder, but so yeah, I'm not sure if that really answers your question. Definitely let us know if that didn't get at it, but.
All right, I've got another question. If anyone else has any, please raise your hand or put it in the chat. But I'm thinking a little bit about the way that you have decided to structure your evaluation, which I think is great, which is like we have this kind of core set of indicators, and then we have stuff that's relevant to you. I think that that's great because it allows folks to really lean into their strengths and kind of define their own outcomes, as opposed to just doing the funder thing, which is like, we want XYZ, and then grantees are like, okay, I'll do that, but that doesn't make sense. So I really like that you're being like responsive in that way. But I'm thinking a little bit about, a comment you made earlier of you have this really broad range of grantees of like, some are really high capacity and like they have a lot of expertise in-house, and then other folks are newer or smaller. I'm kind of sticking with the same theme here of like, where's the sweet spot? But how do you kind of right size that of like, how do you, kind of identify what those really important indicators are? How do you negotiate grantees that have a lot of capacity and maybe want to do more versus other grantees who don't have as much capacity and are, just trying to get by? Kind of what does that conversation look like?
Yeah, so I would say we wanted to start by coming up with metrics that would work. So across the board for all grantees, regardless of size, and really getting at what are these outcomes that we talked about and impact that we want to see, and figuring out what are the metrics that can help look at those outcomes and impact by these different categories of work that all of the grantees do. So I would say that's where we started. We have also, so we provide webinars and training to grantees as well. So we have done like a webinar, for example, on community engaged evaluation methods. So it's not something that we require of grantees to do like an additional evaluation, but we know a lot of grantees do have an additional capacity because they are bigger and they do want to do these additional programs. And so we want to provide support so that they can do these extended evaluations if they want, but that's not necessarily part of the core evaluation for HFDK. Does anyone else from my team want to chime in on that?
Yeah, I mean, I think for an evaluation project of this size with this number of grantees, I think you're completely correct. It is a range of capacity, and yeah, some grantees have a client system down and they can track the exact number of unique clients that walk through their doors and can report that to us with 100% accuracy. We are working with other grantees who do not use such a system, and it doesn't make sense for them to use such a system, on the ground. But at the end of the day, like we as evaluators, we're trying to get like the most accurate number of unique clients reach for this grant as possible. So it's always a balance, it's a negotiation, it's working with those grantees and coming up with the best estimation. And for some, it's like very tailored technical assistance and coming to, to a decision collaboratively that works. And that, we all feel like is the best estimation and best reflection of their work on the ground.
Awesome. Yeah. I mean, I think there's definitely not going to be a one size fits all in this scenario for sure. One more question in the chat. Kind of how did we land on quarterly reporting versus, biannual or annually? Is that kind of where did the cadence come from? And how do you, I guess I'm going to add on to that question. Do you feel like that's the right kind of level of granularity to be making like real-time decisions and program improvement?
Yeah, I can start and maybe Michaela can add on. I think before we came on, it was biannually. And then when we came on, we felt strongly that we wanted to try quarterly because it gave us a more real-time idea of what was happening on the ground. And we had, an intensive like convening with all the grantees to come together and sort of just have everyone on board and like in a spirit of like, let's try this out and see how it works, this quarterly reporting. And we revisit it in a year and see, how people feel about it. So we have done it, and internally, like as a team, I think it really gives us a better picture of what's happening and provide more reactive and proactive TA. And at our most recent convening a couple of weeks ago, when we were, reporting the data and able to facilitate an activity where grantees were looking at their own dashboard, we heard some like sort of aha moments where like people are like, oh yeah, like this is great, you know, seeing my own data on a quarterly basis. Like they can look at seasonal trends, for example, and like really understand what's happening at their organization and think of strategies that, you know, oh, like this metric was a little lower than I expected. I need to look into that, you know, and like being quicker and more nimble in their sort of adjustments of their program or et cetera. Mateo, do you have anything else you want to add about this question?
Yeah, I think the only thing else I would add about that is we don't ask every single question in the quarterly data piece. So there's a set of questions that grantees are asked quarterly, and then there are some additional questions for the annual. So we knew that, you know, some things don't need to be looked at with a trend for every single quarter. So for those questions, they were moved to just once a year being asked. So I think we really tried to be intentional about like what is useful to look at on a quarterly basis and then ask it that way. And I think there definitely was resistance to that change in the beginning, but we really did see, like, we just had this 1 year mark where we brought all of the grantees back together. And, you know, I would say the vast majority of grantees were really happy with the quarterly cadence. And some even felt like it was easier because they were just able to report the data quickly and then, you know, didn't have to hold on to that as long as well. So I think that was another thing that was helpful for us to see.
All right, fantastic. Well, we're coming down to the last couple of minutes here and seeing no more questions. I'm going to go ahead and close this out and get us finished in time. Yeah, there you go. We got a QR code, share your contact info. So just like a few quick announcements. First of all, thank you so much to our speakers for a great talk and a great presentation. Please give it up in the chat and with your virtual reactions. A few things before we all leave. Slides and any materials, those are available on Sched, the online conference platform. You are going to receive an evaluation from us. Shocker, the research and data people want to evaluate you. So please do complete that when you get it. It's helpful for the planning committee. I promise you we read those responses and use them and are responsive to them. But otherwise, we're going to pick up tomorrow morning again at 9 a.m. For a new offering, which are the lightning talks. So we have 6 short presentations about, the title of this is called Future Directions of Public Health, Innovations in Health Justice. So we hope to see you there, and then breakout sessions are going to follow that. And if you have any other questions, the full schedule is available on the website. And yeah, thank you so much. Have a good rest of your afternoon, and we'll see you tomorrow. Take care, everybody.